A groundbreaking combination therapy using statins alongside ezetimibe could dramatically reduce deaths from heart attacks, strokes, and cardiovascular disease, according to the largest study of its kind. Published in the Mayo Clinic Proceedings, this research examined data from over 108,000 high-risk patients, including those who had already suffered a cardiovascular event. The findings are clear. Treating cholesterol aggressively with this dual-drug approach from the outset significantly lowers the risk of death and major heart complications compared to using statins alone. Scientists are now urging doctors worldwide to rethink their approach, advocating for immediate combination therapy instead of the traditional step-by-step treatment model. Statins have long been the gold standard in cholesterol management, working by reducing cholesterol production in the liver. However, many patients still struggle to reach optimal cholesterol levels with statins alone. Ezetimibe complements this by blocking cholesterol absorption in the gut, creating a powerful one-two punch against high LDL cholesterol, commonly known as bad cholesterol. The study showed that patients who started both drugs immediately saw a 19% reduction in overall mortality, a 16% drop in cardiovascular-related deaths, and nearly 20% fewer major cardiovascular events, such as heart attacks and strokes. This is not just a small improvement. It's a potentially life-saving shift in how high-risk patients should be treated. The urgency of this discovery cannot be overstated. Cardiovascular disease remains the leading global cause of death, killing approximately 18 million people per year, according to the World Health Organization. In 2020 alone, high LDL cholesterol was linked to 4.5 million deaths worldwide, with particularly high mortality rates in Eastern Europe and Central Asia. Professor Maciej Bonak, the study's lead author, estimates that implementing this combination therapy as a standard treatment could prevent more than 330,000 deaths annually among heart attack survivors, including nearly 50,000 in the United States alone. These numbers are staggering and highlight just how many lives could be saved if doctors make this approach the norm rather than the exception. One of the most significant findings was how much more effectively this combination therapy lowered LDL cholesterol. Patients on the dual-drug regimen were 85% more likely to reach the recommended LDL target of under 70 milligrams per deciliter, a critical threshold for reducing cardiovascular risk. Despite this, many doctors still follow outdated prescribing habits, starting with statins alone and only adding ezetimibe if cholesterol levels remain high after several months. This delay in treatment may leave patients vulnerable to further heart attacks or strokes that could have been prevented with a more proactive approach. Professor Peter Toth, a co-author of the study, emphasized that for very high-risk patients, immediate combination therapy should become the new gold standard. Beyond saving lives, this shift in treatment could also save healthcare systems enormous costs. Cardiovascular disease is a major driver of hospitalizations, expensive medical procedures, and long-term disability. Untreated or poorly managed cholesterol can lead to heart failure, recurrent strokes, and costly interventions such as bypass surgery or stent placements. By lowering LDL cholesterol more effectively from the start, this strategy could prevent many of these complications, reducing both human suffering and financial burdens on healthcare systems. The findings reinforce a crucial principle. When it comes to cholesterol management, lower is better for longer, but just as importantly, earlier is better. The sooner LDL cholesterol is reduced to optimal levels, the greater the long-term benefits. Researchers hope this study will influence treatment guidelines worldwide, prompting doctors to prescribe combination therapy immediately for patients at the highest risk. Given that both statins and ezetimibe are already widely available and relatively affordable, there is no reason to wait. This is a simple yet powerful change that could redefine cardiovascular care and prevent hundreds of thousands of premature deaths each year. The message is clear. For those at high risk, don't delay, act early, act aggressively, and save lives.